my name is Dr. Jeff Galt. I'm a chiropractor here in Carrington, North Dakota. I've been practicing for some 30 plus years. Along with that, we do acupuncture. I'm a certified acupuncturist in the state. I grew up in Fargo, my wife and I did. We decided to move to a rural area and open up our practice, mainly because we got tired of the big cities, the rush back and forth, and we really enjoy the small town life. How I got involved with chiropractic was when I was in high school. I injured my shoulder wrestling, and we just couldn't figure out what was wrong with it. I did physical therapy, pain management, and finally went to the chiropractor. And within 3 visits, I developed full range of motion. The pain was gone, and I thought that was pretty cool because we didn't have to do any surgery, medications, any of that stuff to get myself healed up. There's approximately 20 chiropractic colleges in the United States. There's the founding father, D.D. Palmer, down in Davenport, Iowa, where I went. But the closest one to Carrington is Northwestern Health Services. That's in Minneapolis. You can get your chiropractic degree there. And you can also get enough credit hours to do acupuncture in most of the states. You need approximately between 100 and 200 acupuncture hours to practice it. The tuition is approximately $12,000 to $13,000 per semester, and there's 3 semesters. It gives you kind of an idea how much it's going to cost. There are student loans out there for it, HEAL loans, loans from the state of North Dakota to continue your education. Once you graduate from graduate school, you need to take 3 national boards. You pass all 3 of those and you're accepted into, I think it's like 45 states in the United States. You also have to sit down and do a Jurisprudence Exam, which goes over the bylaws of each individual state. Most people, it's a thin book, probably 10 pages. You just read through it, and it's a very simple test, and you can pass and go and move forward. Chiropractic is the only true drugless healthcare system in the United States. We don't do any surgeries, we don't do any drugs. We do therapies, like physical therapy, but they're a little bit different. And then also we're allowed to do acupuncture if we have the credit hours for it. And the chiropractic and acupuncture goes together really, really well. Because things that I can't fix with the chiropractic, I usually go with the acupuncture and we help them out, take care of their health problems. The likes about chiropractic, I'm my own boss. I like meeting with people. I like having people heal up without the advent of surgery and drugs. And that's kind of the common trend, the big trend in the United States right now is they're getting away from all the medications. They're getting away from the surgeries simply because they want to be healthy. A lot of the medications create other complications. And we can usually take care of the problems without taking the medications or the surgeries. I can also leave work anytime I want to. We work 4.5 days a week. If there's times that we want to go visit our kids, we just take off and take a day off and reschedule our patients for the following week. The dislikes, any doctor will tell you the things that we don't like is the volume of paperwork. Dealing with insurance companies, and it sometimes can be very mentally draining. One of the nice things is with the paperwork now, there are programs out there where you can dictate into a microphone and it writes your sentences out for you. That's really cut down on the transcription. I used to have to dictate into a dictating machine, then give it to my transcriptionist, and then she'd have to type things up. Now I just sit at my desk and patient entered the office complaining of right neck pain for the past 3 to 4 days after hitting a tree while mowing his lawn. And it just prints it right out. You just put period at the end of the sentences and it works really great. I really enjoy that.
I'm Dr. Paul Ellenbecker. I'm a chiropractor at the Towner County Medical Center. I grew up in Dickinson, and as a football player in high school, I found the need for chiropractic care. And so I would see the chiropractor in Dickinson frequently, which gave me great relief. And near the end of my senior year of high school, my chiropractor asked what I thought I would do after high school. Well, I told him my intentions of being an architect or an engineer. Oh, he says, I think you'd make a great chiropractor. Have you ever considered that? And my immediate thought was, no, that's not my thing. But he talked about it a little bit, and what he talked about really caught my interest. Number one, I knew how it helped me personally. So from that standpoint, I knew it was effective. What I liked about it too was it was natural health care. So everything we're doing as a chiropractor is a natural approach to getting the body fixed, healing itself so it can work like it should. So as chiropractors, we're not prescribing medication, we're not doing surgeries, we're not doing injections. So that was very attractive to me. He told me that most chiropractors are their own bosses. Hey, what a better deal than being your own boss. And he said we can make a decent living. That's fine. So I guess when I started my career as chiropractors, we needed 2 years of undergraduate chiropractic, pre-medicine basically, and then the chiropractic program itself is a 4-year program. And the current requirements now require 3 years minimum of pre-chiropractic education, and the chiropractic program is still a 4-year program. So I did that. I took my prerequisites. I went to school in Davenport, Iowa. The college is Palmer College of Chiropractic. And so I started there in 1982. I graduated in October of 1985. And at that point, I was never coming back to North Dakota. So I had written state exams in the other states I wanted to practice in, and I just didn't find the green pasture I was looking for. So the chiropractor that was mine as a kid made me a job offer to start working with him. And I did that. I started working with him, and it was an intern program. I learned a lot of the basics, and in that time period I decided I wanted to be in my own practice. And this was in 1986. The majority of chiropractors in 1986 were in their own practices, or maybe a group or a partnership. And so I started practice in Minot in 1987. And I still practice in Minot. In 1987, was in one location, moved to another location. And then in 2005, I had an opportunity to come work here. And as a sole provider, sole practitioner, you run the business. If you take days off, you can take any day off you want, but you don't get paid. So everything you do in your own practice, you make or break it yourself. You run the business, you make the decisions about hiring and firing. All the insurance billing is under your control. And when I was approached with the opportunity of working here, it really had some perks. And part of that was that, number one, I wasn't going to run my own business. I was going to be an employee of the medical clinic. And that seemed desirable. I don't have to have the stress and headache of running the business. The best thing though, and the reason I really decided to give this a try, was this is a multidisciplinary environment. So as a chiropractor, I'm working with the medical providers. At the time I started here, there were a couple MDs. They were very pro-chiropractic. We worked together hand in hand. The facility has medical providers, physical therapists. We've got radiology facilities. There's massage therapy here. So it's a very well-rounded approach to patient care. And in my way of thinking, it's the best model of patient care out there. So as I thought about it, I thought, this is a unique opportunity, not so much for me, but for the profession, to show how chiropractors and medical people can work together and not duplicate services. When I'm in my practice in Minot, if I need an x-ray, I send the patient to get an x-ray or an MRI. I can get a report. I might make a referral to a neurosurgeon, and at some point maybe there isn't communication with that person and I've lost the patient, or I've lost the communication or any continuity of care. And oftentimes in that environment there might be duplication of services. I might order an x-ray, they need medical care, they get another x-ray. Totally unnecessary. In this environment here, we have x-ray facilities. All the medical providers and myself are able to see that information. so it doesn't duplicate services. It's a very enjoyable working environment. Patients like it. If I feel the need that this patient might require some medication, I'll make a referral to one of the providers right down the hall. And I can talk to the provider and say, this person's not sleeping, maybe a muscle relaxer would benefit them. The medical provider can prescribe that. It's very simple, it works very well for the patient. Many examples where we've worked together, one that sticks out in my mind, basically saved this elderly man's life. He came to see me, he was a patient I treated many times, and when he came in this day, his presentation was different. He was in extreme pain, continuous pain, his back was just painful, any posture was not comfortable. I did a brief evaluation, I thought something is not normal here. I sent him to get x-rays. And on looking in the x-rays, then we saw an abdominal aortic aneurysm, which can be life-threatening in elderly patients. So immediately talked to one of the medical providers. They ordered the CT scan, which showed greater detail of that aneurysm. The patient was airlifted to Grand Forks and had surgery the next day. The man is still alive, very thankful, his back pain is resolved. The surgery resolved the aneurysm, which was causing his symptoms. Had that been a situation in Minot, I would have likely referred the patient to the emergency room. Had they actually gone there, maybe, maybe not. The follow-up would have been broken up. Maybe the patient didn't get the care they needed, and who knows what the outcome could have been. Patients here are used to having chiropractors. They often ask in another medical facility, if they have surgery in Fargo, for example, my back's killing me. Is there a chiropractor here that can take care of that for me? We don't have chiropractors here. So patients are very excited about that. Like I said, we work together. We're working with physical therapists on a patient's case. Some of the work comp cases can be quite complicated. A recent one, we had me involved, one of the medical providers, physical therapy. She's now seeing massage therapy. She had an MRI. All of it was done here to the patient's comfort and convenience without a lot of headaches and multiple appointments and multiple providers. So that's very nice. From a personal selfish standpoint, I was going to try this for a year. I've been here for 15 years. So as an employee of the facility, I have benefits. A sole provider in my own practice, I make my benefits. If I want health insurance in that situation, I pay for it myself, or I find it myself. In this situation as an employee, I've got health insurance benefits. There's sick pay. There's a variety of benefits that are very attractive to me. So those are some of the decisions practicing in a sole practice where you run the whole show, or in an employee group like this. Rural America, that's where we're at here. A facility like this is vital for rural America. And the fact that we're all here working together gives this whole region an opportunity to get all the health care they need. Practicing in Minot, it's a big town. There's many chiropractors, there's many providers, there's 3 medical groups. There's a lot of splintered care in that environment. I think for rural facilities, this is a win-win for the facility. I think it's a win-win for the patients, and I think it's a win-win for the providers. We all enjoy working together, and we're very personal with our community, with our patients. We know our patients, they're not just a number. And so I think everybody benefits in this setting.
Things that you'll see in an average chiropractor's office is once you get into one of the rooms, you'll see a pelvic bench here for adjusting low backs, mid backs. We have a chair, of course, while we're doing the examination. And then we've got the workhorse of chiropractic, which is a high-low table. High-low table, when you have a hot, acute low back, is really nice. We can place you on this table when you're standing up, lower it down to work on the patient without having them get up and down.
So what I'm going to demonstrate is just how I evaluate patients. As chiropractors, there's many ways to evaluate a patient. What we're checking for is normal joint movement, joint function. And so we're going to check the spine. Where we find joints that aren't working and moving normally, those are the areas we want to fix and correct on a patient. So I've been in practice for 34 years. I've gotten to be very comfortable evaluating a patient just by feel with my hands, and so that's my preferred method. And I can feel the joints, I can feel the dysfunction in the joints, and then after I treat a patient, I can also check them again, and we can feel a difference or see how that's changed. So as I'm evaluating the patient, I'm just going to start at the low back and I'm going to work my way up. I take the back of my hand and I'm just pressing against the patient's spine, and I'm feeling for movement, feeling for function, and we should have a nice springy feel. That's normal, that's what function is. And at this point we're feeling good function, there's good movement here. So I'm going to scan the spine and we're going to check, and again checking for that springy feel. There's good movement, and a lot of times when we get to a point where there isn't movement, the patient is going to feel some tenderness or sensitivity in that area. I just went across a spot there where she's probably a little tender. So then when I find that area where there's some restriction or there isn't that normal springy feel, then what I'm going to do is I'm going to isolate which vertebra it is. So I'm going to take my thumb and I'm going to feel each of the vertebrae in that area to see which one is the one that's stuck and not working and moving freely. And so when we find that vertebra, which is right in here, then what I do is I check it a little further to see in which direction or which way that joint is stuck and not functioning, and then that tells me what I have to treat, what I have to adjust to correct that. So then after I adjust the patient, I'll bring them back oftentimes and I'll recheck that, and we can feel the difference, feel how that joint movement has improved. And in a lot of cases maybe it doesn't improve completely, it might need another treatment or 3 or 4 or whatever. So each time we check it, that tells me then how it's changed, and once we get that back to a normal, we've got the job done, we've got that joint corrected. So that's how I check the spine. The neck, we do the same thing. The patient just leans back against the chair, and same concept where we're just checking joint movement, joint function. Now as chiropractors, we're primarily involved with treating spine. We also evaluate knees, ankles, hips, elbows, wrists, all the joints of the spine, and so we can evaluate those for movement and function. And when we don't find function, we've got something to fix. She's got a problem in her neck right here. That joint is stuck, it's probably tender to her. After we adjust her, we can check that, see how free it is. Most patients will realize, oh, it's not as tender now, it feels better, and we've made a change in that joint.
See, Becky, would you like to come in here? We'll use Becky as an example here. Let's say she has an acute low back that's, we call it a hot low back, a lot of pain, a lot of muscle spasms. By having them lean forward like this, we can lower the table down. Just like this. And then what we do is we work on the patient and we find out where the problem is in the spine. Say it's like the low back. We use a drop piece. Just a very simple light thrust is all we need to do. Like that. And it helps relieve the pinched nerves that are in the area. It opens up the disc space, rehydrates it. And within 3 to 4 treatments, the patient is out of pain and feeling good, and they can go back to recreational activities, work, or anything else they'd like to do. As you can tell, as the machine brings you up, all you have to do is once it stops, is you can push away from the table. And that's how we do it. With the necks, it's the same mechanism. We palpate the spine, find out where the misalignment is. We just set up on it like this, and it's just a little light thrust like that. Sometimes you'll hear a noise, kind of like you're snapping your fingers. Sometimes you don't. It just all depends on the tightness in the muscles in that area. One of the charts that we use is this chart right here. You can tell all these nerves, these yellow nerves coming out through here, all the way down. Spinal nerves actually deal with every muscle in the body. And if you have a nerve root compression in there, or as we call it, a subluxation, it pinches in the neck. It can create arm pain down here, muscle pain. It can create muscle spasms in the low back. It can create digestive problems. There's two types of nerves. There's somatovisceral nerves and somatosomatic nerves. The somatosomatic nerves deal with the muscles in the body. Somatovisceral nerves deals with breathing, digestion, hearing problems, stomach issues, as I mentioned before. And if there's a pinched nerve in that area, and we can trace it, nerve trace it, which we can as a chiropractor, we can eliminate a lot of those problems with it.
Okay.
Now we're going to talk about a little bit about acupuncture. As I stated before, chiropractic and acupuncture have a very good symbiotic relationship. What that means is they work, excuse me, very well together. The cases that I can't take care of with the chiropractic, such as severe pain, muscle spasms, then we go with the acupuncture to help relieve the pain, muscle spasms, so we can do the adjustment. The other factor is things like vertigo. It's your dizziness, where you have to walk on the wall. Chiropractic works fairly well with that, but the acupuncture works extremely well with that. And it's a very simple procedure. It's a very small needle.
Super thin.
Super thin. Pliable. And some of the basic points, people go, well, does it hurt? No, it doesn't hurt. You take the insertion tube, focused in there?
Yep.
Okay, this is called LI4. Just tap it in. There it goes. It's one of the sites. If you hit the acupuncture site dead on, you won't feel a thing at all. If you're off a 1/4 inch to a 1/2 inch, it may feel like a mosquito bite. If you miss the acupuncture site totally, it'll sting. It'll sting. And what's really cool, there was a doctor named Dr. Noget. He was from Germany. And they used to think that these sites were not really existing. And he actually determined that they were. That the bladder pathway, the kidney pathways. What he did was he took a magic marker and he laid out the lymphatic system, blood vessels, arteries and veins, and then the acupuncture system. And he injected bladder 1 with a fluorescent dye and took pictures of it. It would move up, it would glow a little bit, disappear, move up to the next site, it would glow a little bit, disappear. And after he got all the pictures taken, he overlaid them with the computers. And they're mirror images from the old Chinese acupuncture sites that were drawn out 2,000 years ago, which I found was really exciting because it's a physiological entity, not an anatomical entity with it.
The energy system of your body is what you're dealing with.
Right. We're dealing with energy, yin, yang, up, down, left, right. It's fairly philosophical with it, but once you get past that and you start getting into the organics of it, okay, what do we have to do to make this patient better? It's really a lot of fun to do.